Good morning, everyone, and thank you for joining the Clallam EDC Coffee Chat, Coffee with Colleen. We are really excited to have Heidi Anderson on today, the CEO of the Forks Community Hospital. We've been working to have her share the story of Forks Community Hospital for a couple years now, and so we're really pleased that she's able to join us. We they're an important partner in, of course, the Forks community, but an incredibly important employer in our county. I think, are you the largest employer in the West End? Yeah.
In Forks, outside of the prisons. Yes.
Okay. Okay. And so anyway, we're going to have her give her presentation. She's already got it up. And if any of you have any questions for Heidi, please either raise your virtual hand and I'll call on you, or Mitch will. And if you'd prefer for me to ask the question of Heidi, put your question in the chat. So if you'll keep yourself on mute, please, so we don't pick up any background noise, that would be very appreciated. And Mitch will mute you if need be. But so with that, I'm again going to tell Heidi, thank you so much for joining us, and I'll pass it off to her to share with us what Forks Community Hospital has been up to and the impacts that they have on the West End community.
Well, good morning, and thank you, Colleen. I appreciate the invitation, and I'm glad I'm able to finally find some time to present to the EDC. I'm Heidi Anderson. I'm the CEO of Forks Community Hospital. I've been in my role since May of 2020. I actually started at the organization in 1991 as a patient care assistant, worked my way up through nursing and into the chief nursing officer role, left for a couple of years, and then came back into that role again, and then went into the CEO role. I'm born and raised in Forks. My great-great-grandfather was the Iron Man of the Hoe who homesteaded in the West End in 1889. So my roots here are very deep. The community is very important to me, as is, of course, the organization and the other organizations around us. So if I don't have an answer to a question, just make sure that Colleen or Mitch have your contact information. I will be more than happy to follow up with you. I'd like to think I know everything, but usually I'm the last to know sometimes some things within. So yes, welcome. I'm going to try and run this slideshow. So Forks Community Hospital. Our legal name is Clallam County Public Hospital District 1, but we do business as Forks Community Hospital. I'm going to kind of just touch on who Forks Community Hospital is, navigating the challenging financial landscape of rural health, even just the changing landscape of healthcare, shining the light on areas of our excellence and collaborating with community support and growing a healthier West End. So getting to know Forks Community Hospital. So we're a public hospital district, like I said. We're a critical access hospital. And what that means is we cannot have any more than 25 inpatients. We get a cost-based reimbursement back from Medicare. And then we have 3 rural health clinics. We have one just across the street from the hospital, which is our largest rural health clinic, Boga Shield Clinic. We have one about a block and a half away from the hospital, which is Forks Family Medical Clinic. And we have a satellite clinic out in Clallam Bay, which is Clallam Bay Medical Clinic. And a rural health clinic also gets different reimbursement. And our reimbursements are different than what like Olympic Memorial Hospital would have. In our clinics, we have primary care. At our largest clinic, we have our specialty care, we have orthopedics, we have general surgery, we have cardiology, and we have podiatry. We have an award-winning palliative care program that got stood up the last couple years by Sarah Fletcher, our RN case manager. And palliative care is to where we want to keep the patients in our home. Our board had to make a difficult decision a couple years ago to get rid of our long-term care. We were losing over $2 million a year because the reimbursement on Medicaid for long-term care is not good at all. It doesn't even pay 50% of the cost of care. And so, with that, the board at the time and with our strategic plan made the vow that we would do everything that we could to help people stay in their homes and age at home. And this is one piece of that. And we started our transitional care case management, our chronic case management, and our palliative care programs. The palliative care team was recognized last year or earlier this year in March at the Critical Access Hospital conference in Spokane for the care that they're doing and for setting the program up. And we're doing that in collaboration with another hospital down near Walla Walla. We have an outstanding medical staff. We are actively recruiting for a couple of positions. One would be an orthopedic surgeon. We have a second general surgeon coming in October, so we'll have full-time general surgery, which we haven't had for a number of years. And we need one nurse practitioner for chronic pain management care. We have an ambulance service. The hospital has had it owned and operated ambulance service for all the years that I've been here. And like I said, I started here in 91. We have an EMS levy. This EMS levy covers Forks and Clallam Bay. We have worked really hard to ensure that we're gathering the right information and try to get reimbursement on our ambulance because even though we have the EMS levy, the hospital still subsidizes the program. So, for instance, you're at home, your wife falls out of bed, you're unable to get her up out of bed. They dispatch the ambulance to go help your loved one get back into bed. Those are not ambulance runs that we can charge for, nor do we get paid for them. So just an example of things that we're tracking so that we can work and hopefully advocate with the state of Washington to make some changes. Our CNO advocated with the state of Washington last year to get laws passed that a nurse could be in the back of an ambulance for a patient transfer because out in Forks, the weather's not always good, as people know, and helicopters can't get in, or Olympic ambulance might be too busy, and we have a sick patient that needs to get transferred to a higher level of care. And so Kelly Thompson, our CNO, advocated with with Washington State Hospital Association and at legislature and got that law changed.
So
So
CNO stands for what, Heidi?
Chief Nursing Officer, my apologies.
Okay.
Our Chief
Okay.
Nursing
So
Officer.
if it's not a CNO, who had to ride in the ambulance?
The nurses do, the RNs
Okay.
do.
Okay.
I've even done it in the past, not in my current role, but yeah, if it's a BLS, basic life support, two EMTs can go, but if it's an advanced life support, you have to have a nurse or a paramedic. And
Got it.
so
Got
we
it.
are able to put a nurse into the back of the ambulance and go get the patient
Got
out.
it.
We have a foundation, Forks Hospital Foundation, that works hard to fill in the funding gaps wherever possible. Just an example, we lost our mammography unit, gosh, mid 2025, maybe 2024. Time's got away from me there. And we needed to raise money to purchase a new one, and we got a Murdoch grant, and then the foundation raised $500,000 or another $250,000 for $500,000 to
Mm.
purchase that new unit. So it was the largest amount our foundation has ever raised to date.
Wow.
It was
Congratulations.
it was a good thing. So we have nearly 300 employees. We have good paying jobs. We've worked really hard to make sure that we have market wages for actually recruitment and retention as well. We're an economic anchor in the community. Our salaries, as you can see in 2025, were almost 29 million. This year thus far, we're at over 32 million, and we've had to just kind of successfully negotiated both of our union contracts, and so you can see there's definitely impact to the salaries there. We serve about 6,400 patients annually. And the one thing I really want to note on the screen is you can see the amount of uncompensated care provided. So this isn't somebody who doesn't pay their bill. Uncompensated care by law, we have to offer, the state calls it charity care. We call it financial assistance. We're really watching this number. In 2025, you can see it was just over 4 million. Thus far, through the end of July, we're at $4.5 million. And this number is going to grow rapidly with the Medicaid cuts that are on the horizon. And so we're doing things internally to hopefully stem some of that. We're already seeing some of those cuts coming through for those who were covered by Apple Care that were immigrants, undocumented immigrants.
So can you explain that a little bit further? So the uncompensated care are people that are uninsured, and so you said it's not people that don't pay their bills. Is it
Right.
that you don't bill them at all because they're uninsured?
No, they still get billed. So if this is somebody who is living in under the poverty levels, the government, the federal poverty levels, who come to us and say, I've got this $5,000 bill, I don't have the money to pay for it. Our financial navigator works with that individual to see if they qualify for Medicaid. If they don't, then we work with that person and they get put on what's called financial assistance and the bill is wiped out. And the state
Wow.
laws are very generous for an individual. So if I were to get signed up on it today and I have a bill from a year ago, it takes care of that bill from a year ago.
Huh. Okay.
Anybody who comes to the state of Washington that isn't a resident, who doesn't have insurance, can get care under the financial assistance as well as
So
qualify.
so we hear about people going bankrupt because of, a medical issue.
Right.
So that just doesn't happen in Washington state?
Oh no, it still happens because you have to be under the federal poverty
Okay.
guideline. Yeah. You
Okay.
have to be under the federal poverty guidelines in order to qualify for the financial assistance.
Okay.
Mm.
Got it.
Yeah.
And then
So yeah,
that's just an expense that Forks Community Hospital has to eat.
yes, ma'am. Yep.
Yeah. So
Same,
how do
we
you
see
stay in the
it.
black?
Well, we've stayed in the black, but we've stayed in the black throughout this entire year thus far because we've gotten our cost report settlement. We got what's called a dish settlement. We got a distressed hospital fund from the state. So we're really working hard to mitigate that number growing even more with the impending Medicaid cuts and the work requirements that we're actually looking of how we can help people get their volunteer hours and take on the onus of tracking those volunteer hours so we can help people stay on Medicaid.
Okay.
Yeah.
So interesting and great that you're doing that, helping them so that they still are eligible. So you're a critical care hospital, and as I understand it, that means that, and this is all because of OMC is trying to decide, do we go down to 25 beds, which
Right.
you and Forks and Jefferson Healthcare are critical care
Yes.
hospitals. Um, and then that means that the benefit of going from, I think they have 67 beds right now, and they discussing whether to go down to
Right.
25, is that the cost of care for a Medicaid or a Medicare patient would be 102, 103%
It's
of
usually
cost of care.
101% of cost of care.
Okay, 101. But right now theirs is somewhere around 80% of
Yeah,
cost
they
of
are a
care.
PPS hospital. So yeah, and it's different. And a lot of people don't understand,
And
like they'll think
PPS?
PPS, prospective pay system.
Okay, okay.
So they are paid differently than a critical access hospital is paid. And we went critical access in 2003, I believe.
Mhm.
I can't remember exactly the date because I was a staff person at the time, but I believe we went critical access around 2003.
Okay,
Um,
and I think I misspoke. Michelle put in the chat that critical access hospital is not critical care.
right,
Here's a
critical
good
access.
explainer. So thanks for putting that in the chat, Michelle.
Yeah. So we do want to make sure that we can provide as much as possible in Forks so that we can help patients not have to leave the community for care. So just to go to Port Angeles and back is roughly 114, 115 miles, Forks to Port Angeles, right? And we all know how expensive gas is right now. I don't think, it's costly. And if you're living, in poverty or just above poverty or, the middle class working poor, if you could get care here and not have to travel, that is a great thing. And so that's what I'm looking at is what can I bring to Forks, whether it's telehealth or a specialist in for a day a month so that patients can get the care here. So, speaking about the challenging financial landscape, so as you can see on my slide, reimburse, reimbursement challenges. Traditional Medicare provides FCH with cost-based reimbursement for inpatient and outpatient services. It's outpaced by the rising operating costs and loss of covered lives. So if you remember back to the slide, just what salaries have increased so far and what our uncompensated care financial assistance has increased so far in 2026. So we're looking at the impact of a couple things. We're looking at the Medicaid cuts from HR1, but we're also looking at Medicare Advantage programs. So I understand why people go to an MA product, right? It's offering them all the things they need from drug coverage, vision, dental, hearing at a cheaper cost.
MA coverage is what?
Medicare Advantage.
Okay.
These plans are not always what they're cut up, cut or aren't always what they are meant. They're great for the patient, not so great for the provider. I'm going to use United Healthcare for example. Um, we have worked really hard. Let's say you're covered by United Healthcare and you need to see a cardiologist or you need to have an MRI. We are having to work really hard behind the scenes with United Healthcare to get those services authorized. If you're a United Healthcare patient and you see your regular provider, but you're ill and you need to be seen for bladder infection, let's say, we have to get an authorization for you to be able to see that patient. If we don't get that authorization, or for you to see that provider, if we don't get that authorization, we don't get paid. The patient will still get seen, but we don't get paid. And so there's a lot of little intricacies behind the scenes that go on to ensure that we are going to get paid for the services that we provide. And I see a question just came into the chat, Michelle. Colleen.
Yes. So it's from Ed Bowen, and he says, what is the chance that Hospital District 1 will enter into an agreement with Federal Veterans Affairs to provide the VA's urgent care program?
We are able to see VA patients. And so will you send me that questions and his information so that I can make sure I follow up on that? But I know we have veterans that we see where we're their primary care providers.
So, and he added, this isn't the community care program that needs VA
Okay.
authorization for services. It is the
Okay.
program that OMC has with their walk-in clinic that allows a veteran with a VA healthcare VIC card to walk in for what the VA calls urgent care to preclude having to go to the emergency
Oh,
room for
okay.
non-emergency care. The card gives the hospital.
Oh, okay. I will look into that. I hadn't heard about that one. I knew about the community care one, but I didn't know about that program. We don't operate a walk-in clinic, so yeah, that would be interesting. I'll look into that.
Great. Thank you.
Thank
Er,
you.
Appreciate it. Thanks for the question, Ed.
So here's again, I kind of already talked about this, the disadvantages of a Medicare Advantage versus a traditional Medicare plan. So Medicare Advantage plans impact our financials, like I kind of discussed. One more disadvantage of them is the erosion of traditional Medicare reimbursement rates, especially for a critical access hospital or a rural health clinic. Like I said, we're cost-based reimbursed for of 101% by Medicare. So so it is a Medicare designation to be a what you call a CA or an RHC. MA plans usually pay a rural provider less than what traditional Medicare rates are paying. And we rely heavily on the cost-based reimbursement, on the per diem rate for inpatient and swing bed services and at a cost to charge ratio basis for outpatient services. And I just saw another question pop. Sorry, I'm trying to watch I can't see the chat.
Yeah, Dr. Sarah Huling says critical access hospitals are at 101% without the current 2% sequestration, which
Mhm.
puts reimbursement at best 99%.
Yeah,
I don't, 2% sequestration, what does that mean?
yeah, I don't know as much about that, and I know about it, but I don't know a good way to explain it. So, um, yeah, all I know is that it is a rock and scissor game. Let's just say the basically it's backwards. And I've always said this, even when I was a frontline staff, I said it's backwards. The higher your costs are, the more you get reimbursed from Medicare on your cost report. The less that you spend, the less you get back.
Hmm.
So it's backwards, right?
Yeah.
Yeah,
There's no incentive to keep costs low.
exactly, exactly.
Hmm.
So yeah, I don't know. It helps to keep us alive. Oh, there's another question.
Well, I think Michelle's putting in really good links for people if they want
Okay.
to
Oh,
get
good.
further information.
Thank you, Michelle. So, in addition to navigating the MA plans, FCH is also mindful of changes occurring to Medicaid, and I've kind of already alluded to that. So, Apple Health is a Medicaid product, and it covers about 2 million Washingtonians and 1,200 in Clallam County. At Forks, we have 574 patients that are covered by Apple Health. So, these are the patients that are going to have the work requirements, volunteer hours, those things. And so we're working on the back end to see what we can do to help those patients keep their coverage. Um,
Are undocumented immigrants able to get Apple Health?
they're going to lose
No.
it. Some of them
Okay.
have already lost it. They said October, but we're already seeing an impact on that.
Huh.
Yeah.
And
And
so
so
how many people were there in that category?
I don't have that number. I only got the Apple Health number for the 574. Um, I They could be in that 574 number. I just asked how many patients do we have covered by Apple Health. I didn't distinguish
Got it.
between undocumented or not. So those undocumented workers or covering patients that are covered by an Apple product and losing it will then get care most likely under that uncompensated care under the financial assistance.
So it'll be an expense to the hospital,
Once
thus
again,
to the
yes.
community. Okay.
Yeah.
Got it.
So, and we're doing our best to try and hold on and keep everybody's jobs intact for the health of the community, right? We're the largest employer
Yeah.
there, and our employees put a lot of money back into the community and into the county. So, according to Washington State Healthcare Authority, 2 to 320,000 Washingtonians are projected to lose their Medicaid coverage. So if we just have a fraction of that, that's the patients that we need to work with to help them keep their coverage. Washington's projected to lose billions in federal Medicaid funding between 2025 and 2034, and the cuts will impact our county budgets, especially in rural and high poverty areas, and could lead to reduced service capacity unless offset by state or federal funding. And I just saw another question pop up.
Is the state trying to supplement that? Aren't they trying to?
They're trying in different ways. The bottom line is for Medicaid, the state needs to increase their Medicaid rates, their payment rates to us. Or if they would have done that, we would have kept our long-term care. We got paid, let's say, $347 a day for one patient by Medicaid per day when the cost of care is over $700 a day for that one patient.
Mhm.
So that is one of the reasons that's a huge
Yeah.
um, difference. They weren't even getting close. And even if they raised the rate, it wasn't closing the gap. And we had to figure out how to close that gap. And so we made the decision to make the change in our licensure like we did.
Okay. Got it.
Oops, did I thought I bumped too far ahead. So speaking of what's in the future, 2025 federal legislation impacting Forks Hospital is the HR1 Medicaid cuts will create the financial strain, and we've already are seeing that. Increased administrative cost, increased amount of uncompensated care, reduced revenue, and potential service cuts. So that's what I don't want to see. I don't want to cut services. And so we have to work as a group of how we can keep things going, add things that we need that meet the needs of the community. Is there another question?
Uh, m- let's see. Yeah, no, it's good. It's just Marcia would like to meet with you, so we'll send that email on
Oh,
to you so you can connect with her. Yeah.
great. That would be great. I would love to meet with her. So how is Forks Hospital challenging meeting the challenging? So we put into place a financial navigator a couple years ago, and some community outreach patient resource specialists to work with patients so that we can get them in to meet people rather than them having this large bill, so we can find out if we can get them signed up for Medicaid or an insurance plan or get them under financial assistance. And so we have those staff members in the hospital and in the clinic, and then of course just under the plain hospital. They have just an office in the organization that they meet with people. The other thing we're doing is if a patient, let's say over a holiday weekend or a weekend, is seen, doesn't have any insurance, by Wednesday, that patient is contacted by somebody within the organization to say, hey, we saw you were here. What can we do to help you? Can we help you get, signed up on an insurance plan or Medicaid, or do we need to get you covered under a financial assistance? One of the cuts to Medicaid in the past, if you didn't have care and you were that patient that came into the ER, now you have like an $8,000 bill, we could help you get signed up on Medicaid. That coverage would go back 90 days. That coverage now for some is only going to go back 30 days. So the clock has started to tick from the time they come in the door. And so we are being forward thinkers and being ahead of the game by getting a hold of those patients early. Our website features dedicated sections explaining a range of financial matters. So we have our price transparency tool, which is a requirement, our insurance plans accepted, financial assistance, and more. And then we'll have additional education tools coming soon. So Forks Community Hospital Palliative Care Program, I already talked about it. I'm proud of this program. I'm proud of the staff that have put this program together that take care of the patients. It's great. So what is palliative care? It's medical care for patients with serious or long-term illnesses. Focuses on the relief of symptoms and stress, aims to improve their quality of life, can be provided alongside curative treatment and not limited to end-of-life care. However, we are taking care of patients within this program that are dying at home. Here's some of our providers. I apologize, there's a provider on here that's no longer with us. We lost her recently because they moved out of the area. But we don't have all their photos, but there's the majority of our providers. A couple faces, I think that some of the community members from Port Angeles might know, like Joe Reese and Dr. Peterson and Dr. Frisweld. We have a diabetic educator as well who meets with patients. We're always recruiting, so here's some snapshots of some of our staff. So our hospital is embarking on our strategic plan for 2027 to 2029. Part of that is we do a community health needs assessment. And so we will be putting out a community survey. Well, along with that, we'll do a staff survey, and we'll be putting together some focus groups to hear from our community where they feel Forks Community Hospital should head. I do a CEO message. It's on our website every quarter. And we just redid our website a couple years ago, and it really is a beautiful website. And that is all I have for slides.
Great. Thank you, Heidi.
I feel like I talked too fast. I apologize for that.
It's a lot of information. Do folks online have further questions for Heidi? Let's see, I see a new one in the chat. Mike French asks a question about EMS services. It's been discussed recently that it's been difficult to retain EMTs in the Clallam Bay CQ area, especially Fire District 5.
Yes.
How does the Forks go?
Oh, I can answer. I know exactly what he's talking about.
Great.
So,
I've got bad internet here.
No, you're fine. So currently, our staff at Forks are responding out to Clallam Bay and taking care of the Clallam Bay community with ambulance services. Nia Bay is also doing some of that. So what we're doing to help them, they've got three EMTs in the community that have gone through an EMT program. They need to get their basically clinical hours, so ride-alongs and patient hours. We have a EMT trainer who is going to work with them to help them get their hours and get them ready to take their national exam. It's not going to be anything that happens just over a couple of weeks. We're talking probably a 6-month period of time. So we have stepped up and we are taking on that cost to help them get trained and certified and so that they can get coverage for their community. Their community can't go without coverage, obviously. Years ago, Forks Hospital used to be the sole coverage for Clallam Bay and had a site out there. So we are working with them. I'm going to pull the chat up. I'm not sharing anymore so I can see it.
I can read it to you. So Mike answered, great answer. Thank you, Heidi. Appreciate all you do. And then Beth says there's another conversation that's embedded here. As Medicaid cuts hit long-term care harder and harder, we will find that more of our community members cannot find a local solution to meet their needs and are going to have to leave the peninsula for care if care at home is not possible. This will be a huge family burden for our employers.
I
It's a good
agree.
point, Beth.
Great point. Yeah, and that's the one reason why we put the palliative care program up.
So, and then Stephen says, what are the most important needs Forks Community Hospital has in terms of clinical workforce? And Stephen is from Peninsula College.
Mhm.
How
So,
difficult is it to recruit staff in the specializations you need?
yeah, so right now our biggest challenge is laboratory techs, lab techs.
Hmm.
And so a program of some sort would be great. Of course, it needs to be a bachelor's level for some. Um, it used to be years ago, it was X-ray techs. The market got flooded, but we're also having some difficulty in our X-ray techs right now, ultrasonography and MRI techs. So I haven't reached out to Susie, but I was going to. I've reached out to Department of Health on both of those. And then mental health specialists, but I know that Peninsula College has their BSN, their BS program there. So that was a great thing to do.
So, how long does the training take to become a lab tech?
Yeah,
And
it's a
then
bachelor's
what's the
program.
starting pay once they finish?
Oh, I couldn't tell you the pay off the top of my head. I want to say probably in the $40 an hour range, but I don't
Oh,
know
that's
that for
great.
certain. I don't
Uh-huh.
have all that in my brain, unfortunately.
That math works. And so is it a 2-year or a 4-year
Four,
program?
4-year
Okay.
program.
Uh-huh.
And we
And
have two staff members that did their programs online and did their clinical here that are now working
okay.
in our lab.
Okay.
And we
Great.
do have a grow your own idea here. So we just got certified to be part of the RNEP, the Rural Nurse Education Program. So we're a certified site, and we have three nurses that are going to be doing that program, two starting in 2027 and one in 2028. It
Mm-mm.
used to be called the Roan program.
So Paul Gottlieb has a great question. To what extent does the hospital provide labor and birth services, and what's in store for the future regarding pregnancy care?
Yeah, so the hospital had to close our labor and delivery services a few years ago. We lost a provider. So 2 years ago, so I'm going to give a 4-year period. Over a 4-year period, I was recruiting for a family practice OB doc. I got one. Well, actually, one came right before I came into this position, but the CEO prior to me had been recruiting. The hospital was spending well over a $500,000 just to find providers that would come in so our employed family practice OB doc could have time off. So this doc otherwise would be on 24/7, 365. So one cost to us was over a $500,000 in bringing in providers to give them time off. We only had 32 births the last year that we did OB. We have to have at least over 100, if not 200 to break even. The numbers would need to be reran now because this was a couple years ago. 3 years ago, when we pulled the data, there were not even 100 births in our district or in Clallam, in our district. So it would be one of those services that you offer that you still have to support, that it would be a losing service. The majority of our deliveries were Medicaid, so that doesn't get paid as well as like a commercial payer. I don't know where we're at because the thing is when you have a low amount of births, people lose their skills, and that's scary. You don't want a bad outcome. You're not dealing with one patient, you're dealing with two patients. And OB is a specialty skill, and staff, the provider and the staff need to keep their skills up. So I don't know what we will do. Many of you have probably seen that North Olympic Healthcare Network has gotten a HRSA grant. They'll be putting a clinic out in Forks. I talked with them yesterday. It's something that I fully support them out having a clinic out here. Patients deserve a choice. We've had a good working relationship with the North Olympic Healthcare Network. And I talked with them yesterday. They're not necessarily going to have an OB provider or a provider out here 5 days a week that does OB. But if that can ever come to fruition, then I think that we can have some discussions about what we can do. So pregnant mothers in our community have been getting care at the North Olympic Healthcare mobile unit that's been coming out once a week for months. If they don't choose to go elsewhere, then they would have to travel to Port Angeles. And a lot of
So,
people are like, but an hour is a long way to drive. And I thought about it and thought about it, and I went, if you live like in Eatonville and have to deliver at Swedish Hospital, you're going to be driving at least 45 minutes. And if traffic is bad, you're well over an hour. So to put it into perspective, I really thought about that. And I'm like, it is a long ways. But if you're in the city and you're in traffic, or depending on where you live and how long it takes to get out of Eatonville out through Puyallup, you're over an hour possibly.
yeah, if that with that traffic. So, what is the advantage to the community to have North Olympic Healthcare Network known have a separate healthcare service? Obviously, choice.
Mhm.
Um, but from a financial standpoint, I always think that like merging things makes more sense because of the reduced overhead costs.
Mhm. Yeah.
But
So here's two things, Colleen. I agree. Everybody should have a choice, right? The second thing is they're going to bring some services in that we don't have the space to do, dental and vision. They're going to have
okay,
dental. Their goal is to have dental once a week and vision once a month for adult and pediatric Medicaid patients. That is
mm,
huge for our community, and that's
okay,
something we don't have the space to do. Secondly, they will send patients to us for ancillary services, so lab, x-ray, physical therapy, and we do well with those departments. That's where those usually are they're revenue generating departments. And so we will get that revenue without having additional overhead.
got it.
So
Okay,
it's a
great.
win-win.
That's terrific to hear. So Dr. Sarah Healing says, how does leadership know if they are meeting the needs of their constituents within the district they are tasked to serve? And so before you answer that, tell us exactly where your district begins and where OMC Hospital District number 2 ends. Where's
Yeah.
that line?
The line is like the west end of Lake Crescent, and then we go up into Nia Bay and down towards Clearwater, which is beyond Queet. Claylock is where that's West Jefferson County. Okay, so
Yeah.
you got two counties down there. Um, I kind of go by where our ambulance responds to. So we do respond all the way up to Salt Lake Hot Springs. We can respond up into Nia Bay if needed, and we respond all the way down into Clearwater.
So Clallam Bay CQ is part of your district, is that
Yes.
right? Okay. But Joyce is part of Port Angeles.
Yes.
Okay, got it.
Yeah.
So anyway, back to Sarah's question,
Yeah.
thoughtful question.
So, what we do, and we're learning, Washington State Hospital Association has a platform called Dash, which what that is, it's a claims payer uh, data source where you can go in and put in the information and find out where patients that live within your zip code are going to get care and what kind of care they're getting. So one of the things that when I pull some of the reports, that we have a lot of patients going out of our community for urology, and Port Angeles has urology. And so when we sit down to do our strategic plan, we will have this information so that we can look at it and the board and leadership can plan accordingly to what services we need to look at. Now, if you have, let's say, 15 patients in our community that are traveling to Port Angeles for kidney dialysis, that may not necessarily be a service line that we want to bring forward, A, because it's a specialized service. Maybe the equipment, I haven't looked into it. Maybe the equipment is really expensive. That may not be a service line for a need for our constituents that we could meet, if
Okay,
that makes
got it.
sense.
Interesting. So it sounds like an incredible tool.
Yes, it is a good tool. And
Yeah,
there's a couple tools out there. It's it's challenging to learn when it's something you don't use every day. And every little thing that you choose has 15 more um, options. And so my patient safety quality risk officer has been learning how to use it, and I know how to use it enough barely to get me by, but I'm learning it more and more.
right.
It's a
The
challenge.
nuances of the discriminators can
Yeah.
really change the outcomes, I'm sure.
Yes.
Let's see. Does anyone have any additional questions for Heidi? We got her here online. John says, is there anything that could quickly be done in 2027 if a party majority changes in Congress?
Um, I honestly don't know. I don't know. I go to the advocacy days every year in Olympia with the Hospital Association. I don't know at the congressional level. I don't know if anything will quickly change. What I think is with HR1, it's a 5-year program. We are going to have a presidential change during those 5 years. And so I don't know what that looks like. I don't know if that means RHTP dollars for the 5th year will be there. I don't know. That's a great question. I wish I had a crystal ball. I wish I don't know, John. That's a great question. I know how I would like it to change, but I don't know if it will.
Michelle says, please follow Forks Community Hospital on Facebook and on LinkedIn.
Yeah.
Great. Yeah, so the one big beautiful bill, I know that went forward many years, but if the
Mhm.
Democrats or if another Congress wanted to change that, there's nothing stopping them from changing the laws regarding SNAP benefits and Medicaid, that kind of thing.
Nope.
Yeah.
Yeah.
Okay.
Paul asked if we partner with tribal communities. We do try to work as much as possible with the tribal communities, but what we are doing under RHTP is we are going out for some extra funds to create a care agreement with the Ho tribe down that's south of Forks in West Jefferson. And we do some stuff with Quileute, but Quileute tribe is building their clinic up more, and they have new directorship. And Nia Bay has always had a great clinic up there where they meet a lot of the needs of their patients. But we get a lot of the specialty patients for specialty services.
That's great. Heidi, what's been the response to the palliative care? Have the services been utilized?
Oh, we are looking at having to add another nurse because we have one nurse doing the program and she's just about at capacity. So I want to say there's 57 patients in palliative care right now.
Yeah.
Yeah. Been it.
Other question is, Forks being as beautiful it is and such a destination, how often do you see tourists come into the hospital? Is that a regular
Daily.
occurrence? Yeah,
Daily.
I bet.
Yeah, it's very busy out here. You know, we have one stoplight and you used to maybe be back a block. Sometimes you can be back 4 or 5 blocks now. It's very busy right there at the stoplight in town. People crossing the street. It really raises my blood pressure because people don't watch the walking signs. And I almost hit somebody probably about 3 weeks ago. I was taking a left turn onto the highway and they jaywalked and they were right in the blind spot of the arm of my windshield and I just about ran her over and yeah, That's almost where you have to pull over and let your heart rate settle before you can keep driving. It's just so many people, and we're not used to that. And it's not just now during the summer, it's year round that we have tourism now. And I know that the Hoh Rainforest has broke visiting numbers, as has our Chamber of Commerce Visiting Center has broke record numbers.
Can you imagine accidentally hitting someone with a car, not at fault, and then having to scoop them up and bring them to your hospital? That
Oh,
would
that
be,
would be horrible.
yeah, no kidding.
Yeah.
No, that's great. Any other questions in the chat? I don't see anyone. Anyone want to
Let
raise
me
your
throw
hand?
my, I want to throw my email in the chat if anybody wants to reach out to me. And we have really good filters. So if you don't hear back from me, I'll also throw my number in here. Please give me, this is my assistance line. Give me a call or send me an email because I don't filter I get so many junk mails. I get like probably 300 a day. I don't filter all of them. And sometimes private emails will go to that, or like Michelle just put in there, forkshospital.org. You can go there and that will be an email. Info at Forks Hospital goes to my assistant.
That's great.
I really want to thank you for asking me to do this. Probably should do something yearly so that you get to hear a voice from the West End. I looked on your YouTube channel. I didn't see a bunch of representation from the West End, so I'd be most happy to do that.
Sounds great. Let's plan on it. And like Kelly just commented, it said, thank you. This was inspiring. It truly
Thank
was.
you.
We appreciate everything you do for the West End of our county. It couldn't be more important. So thank you so much for joining us today. We will have this, it's recorded, so we'll have it up on our website later today. So feel free to send it out to whoever needs an update on Forks Community Hospital. And with that, Heidi, thank you so much. And everybody enjoy the rest of your day.
I thank you for myself and from our team, all of our employees. I can't do it without them. They're a
Thank you,
great
Heidi.
team. Thank you.
Really,
Have a great
really
day,
very
everybody.
inspiring and look forward to
Thanks.
making contact.
Thanks. Thanks, Kelly. Bye bye.